If you're over 60 and you're taking a calcium supplement for your bones but still worrying about your heart health, you might be missing a critical piece of the puzzle. You see, calcium doesn't work alone. It has an essential partner that most seniors are dangerously deficient in, a mineral that directs calcium to your bones and away from your arteries, preventing them from hardening. Without it, you could be strengthening your skeleton at the expense of your heart. Hi, I'm Dr. Jacob Hoban, a board-certified nutrition specialist focused on senior health. Today, we're not just talking about calcium. We're talking about the powerful duo of calcium, W, and magnesium, and I'm going to give you 4 natural, delicious food sources where you can find them together, working in perfect harmony for your body. After 60, our bodies undergo a delicate mineral shift. We need calcium for strong bones, but we need magnesium to make sure that calcium goes to the right place. Think of magnesium as the wise traffic director for your body's minerals. It guides calcium into the bone matrix, where it belongs, and helps keep it out of your soft tissues, like your arteries, where it can cause calcification and increase the risk of heart disease. A review in the Journal of the American College of Nutrition found that adequate magnesium intake is associated with higher bone density and a significantly lower risk of coronary artery calcification. Furthermore, our ability to absorb these minerals decreases with age, while our kidneys excrete more of them. This makes getting them from the right food sources, where they are perfectly packaged for absorption, more important than ever. The 4 foods we're going to cover are not just good sources. They are powerhouses that provide these 2 minerals in a bioavailable form, along with other cofactors that help your body put them to use. And the 4th one is a true superfood that most people overlook entirely. Let's start with the most important category, dark leafy greens. I'm talking about spinach, kale, collard greens, and Swiss chard. These are nature's multivitamin, especially when it comes to our dynamic duo. For example, 1 cup of cooked spinach provides a substantial amount of magnesium and a good dose of calcium. But here's the key. These greens are also rich in vitamin K. Why does that matter? Vitamin K activates a protein called osteocalcin, which acts like glue, helping to bind calcium directly into your bone tissue. Without it, calcium is less effective. However, some greens like spinach are high in oxalates, which can bind to calcium and reduce its absorption. The simple fix? Lightly cooking or steaming your greens neutralizes a significant portion of these oxalates, making the minerals much more available for your body to use. Takeaway: dark leafy greens are your foundational mineral source. Eat them cooked most of the time to maximize the calcium and magnesium you absorb. The second food is one you can enjoy as a satisfying snack: almonds and natural almond butter. Just 1 ounce of almonds, about a small handful, provides over 75 milligrams of magnesium and about 75 milligrams of calcium. That's a powerful 1-2 punch in a tiny package. But the benefits don't stop there. Almonds are also packed with healthy fats, which are essential for the absorption of fat-soluble vitamins like vitamin D, which is, you guessed it, critical for calcium absorption. It's a virtuous cycle of nutrients. Furthermore, the protein in almonds helps support the underlying collagen matrix of your bones, making them flexible and resilient, not just hard and brittle. Choose raw or dry roasted almonds without added oils and salts. A tablespoon of natural almond butter on whole grain toast is a perfect, mineral-rich start to your day. Takeaway: almonds are a convenient, nutrient-dense package that delivers both calcium and magnesium, plus the healthy fats needed to put them to work. Now for a surprise that might change everything you think about calcium: canned salmon and sardines with the bones. I know, the bones, but hear me out. These soft, edible bones are where a massive amount of highly bioavailable calcium is stored. A 3-ounce can of sardines can provide over 300 milligrams of calcium. That's about a third of your daily need. And it comes paired with a healthy dose of magnesium. This is the form of calcium your body recognizes and uses most efficiently. Plus, these fatty fish are one of the best sources of omega-3 fatty acids, which are proven to reduce the inflammation that contributes to both bone loss and heart disease. A study in the American Journal of Clinical Nutrition found that older women who ate fatty fish twice a week had a significantly slower rate of bone loss. Don't be afraid of the bones. They are soft, completely edible, and you won't even notice them when mashed into a salad or patty. Takeaway. Canned salmon and sardines are a direct injection of bone-building calcium and magnesium, with the added bonus of anti-inflammatory omega-3s. Our fourth and final food is the humble black bean. Beans are an unsung hero in senior nutrition. 1 cup of cooked black beans provides nearly 120 milligrams of magnesium and over 40 milligrams of calcium. But their power goes far beyond just those numbers. Black beans are loaded with fiber. This fiber is crucial for gut health, and a healthy gut microbiome is now understood to play a key role in bone density by influencing inflammation and mineral absorption. Furthermore, the combination of magnesium and fiber in beans helps regulate blood sugar, which is vital because high blood sugar can lead to increased excretion of both calcium and magnesium through the urine. They are incredibly versatile. Add them to soups, salads, or make a black bean burger. They're affordable, shelf-stable, and a true cornerstone of a mineral-rich diet. Takeaway. Black beans are a triple threat, providing minerals, gut-healthy fiber, and blood sugar support all in one. Now, how do you bring this all together? You don't need to eat all 4 every single day, but you should aim to include at least 2 of them daily. Here's what a simple, mineral-rich day could look like. Breakfast, a spinach and mushroom omelet. Lunch, a large salad with a can of salmon and a handful of almonds. Dinner, a hearty chili made with black beans and served with a side of steamed kale. This isn't about a radical diet overhaul. It's about strategic additions. Keep canned fish and beans in your pantry. Have a bag of frozen leafy greens in your freezer. Keep almonds on hand for a snack. By making these foods a regular part of your routine, you are consistently supplying your body with the raw materials it needs to keep your bones strong and your heart protected. Let's do a quick recap. To get the calcium and magnesium you need, focus on these 4 natural powerhouses. 1. Dark leafy greens. For a foundational dose enhanced by vitamin K. 2. Almonds. For a convenient, healthy fat pack source. 3. Canned salmon and sardines. For the most bioavailable calcium and anti-inflammatory fats. 4. Black beans. For a fiber-rich source that supports overall metabolic health. Remember, these 2 minerals are a team. By getting them from whole foods, you ensure they work together, protecting your entire body from the inside out. If this video helped you understand the critical partnership between calcium and magnesium, please do me a great favor and hit that like button and subscribe to the channel for more science-backed nutrition. I'd love to know in the comments, which of these 4 foods are you most excited to add to your diet? And because strong bones need more than just minerals, my next video is essential. The 5-minute weight-bearing exercise seniors can do at home to reverse bone loss. The results from this simple routine are truly remarkable. Stay strong, my friends. I'm Dr. Jacob Hoban. I'll see you in the next video.